When you're experiencing infertility, how long will it take to actually get started with treatment? Hi, I'm Dr. Eric Flisser, Medical Director of Reproductive Medicine Associates of New York. Patients who come in for infertility are often already frustrated, given that depending on how old they are, they've already been trying for a year or maybe 6 months without success. But getting started with infertility treatment requires some initial workup before we can choose the right treatment plan. For most people, this involves getting a semen analysis, a hysterosalpingogram, which is an imaging test of the uterus and the fallopian tubes, and some hormone testing. Luckily, we're not stuck in the old days of testing on day 3 of the menstrual cycle, but hormone testing must be done. So that can be done probably at your first visit, whereas an HSG, by nature of the test, has to be scheduled really before ovulation but after the period, so typically the second week of the menstrual cycle. And a semen analysis can be done at any time, typically with about 3 to 5 days abstinence prior. The results of all these things can either be the next day or sometimes a few weeks, depending on who's doing the interpretation. So it's reasonable to think that the workup will take about a month before you can get down to treatment, although every once in a while we can do empiric treatment simultaneously.